Are you feeling tired or experiencing muscle cramps? You might be suffering from potassium deficiency. Potassium is an essential mineral that plays a vital role in many bodily functions, including muscle contractions, nerve impulses, and fluid balance. In this video, we'll dive deep into the world of potassium deficiency, exploring its causes, symptoms, and solutions. Let's talk about one of the most common symptoms of potassium deficiency: muscle weakness and cramps. You see, potassium is like the electricity that powers your muscles. It helps transmit signals from your brain to your muscles, allowing them to contract and relax. But when your potassium levels drop, those signals get disrupted, leading to muscle weakness, spasms, and those annoying cramps that can strike anytime, especially during or after exercise. Imagine trying to run a marathon with a low battery. Your legs just wouldn't cooperate. That's why it's crucial to maintain adequate potassium levels for optimal muscle function. But it's not just about athletic performance. Potassium deficiency can impact your daily life in subtle ways. Simple tasks like climbing stairs or carrying groceries can become challenging. You might experience muscle fatigue more easily, making you feel tired and sluggish. If you're noticing these symptoms, don't ignore them. Feeling constantly tired and drained even after a full night's sleep? Potassium deficiency could be the culprit. You see, potassium plays a crucial role in energy production. It helps convert the food we eat into usable energy that powers our cells. When your potassium levels are low, this process becomes inefficient, leaving you feeling weak, fatigued, and lacking motivation. It's like trying to run your car on an empty tank. You won't get very far. This fatigue can manifest in various ways. You might find it hard to concentrate at work, struggle to stay awake during the day, or simply lack the energy to do the things you enjoy. Even simple tasks can feel exhausting, making you feel like you're running on fumes. This constant tiredness can significantly impact your quality of life, affecting your mood, productivity, and overall well-being. But it's not just physical fatigue. Potassium deficiency can also lead to mental and emotional exhaustion. Low potassium levels can disrupt the delicate balance of electrolytes in your brain, affecting your mood, focus, and cognitive function. You might experience brain fog, difficulty concentrating, or even mood swings. This mental fatigue can be just as debilitating as physical fatigue, making it hard to function at your best. So, if you're constantly feeling tired and drained, don't just brush it off as stress or lack of sleep. Consider the possibility of potassium deficiency, especially if you're experiencing other symptoms like muscle cramps or digestive issues. Remember, your body is talking to you, and it's important to listen. Let's talk about how potassium deficiency can wreak havoc on your digestive system. You see, potassium plays a vital role in maintaining the smooth muscle function of your digestive tract. These muscles are responsible for the rhythmic contractions that propel food through your intestines. When your potassium levels are low, these muscles become weak and sluggish, leading to a whole host of digestive issues. One of the most common problems is constipation. Without adequate potassium, your intestines can't contract effectively, making it difficult to pass stool. This can lead to bloating, discomfort, and even abdominal pain. And trust me, constipation is no fun. It can make you feel sluggish, irritable, and impact your overall well-being. But it's not just constipation. Potassium deficiency can also cause nausea, vomiting, and even abdominal distension. These symptoms can be quite alarming, making you feel like something is seriously wrong. And in a way, it is. Your body is trying to tell you that it needs more potassium to function properly. Now, digestive issues can be caused by a variety of factors, from stress to food intolerances. But if you're experiencing these symptoms along with muscle cramps, fatigue, or other signs of potassium deficiency, it's worth investigating further. Don't ignore your body's signals. Now, let's talk about a more serious consequence of potassium deficiency: abnormal heartbeat, also known as arrhythmia. Your heart, a tireless muscle, relies heavily on potassium to maintain its regular rhythm. Potassium helps regulate the electrical signals that control your heartbeat, ensuring a smooth and coordinated contraction of the heart chambers. When your potassium levels drop, these electrical signals get disrupted, leading to irregular heartbeats. You might experience palpitations, a feeling of skipped beats, or a racing heart. In some cases, potassium deficiency can lead to more serious arrhythmias like atrial fibrillation or ventricular tachycardia, which can be life-threatening. When potassium is deficient, your heart rhythm becomes irregular, compromising its ability to pump blood effectively. It's crucial to understand that abnormal heartbeats are not something to be taken lightly. If you're experiencing palpitations, dizziness, chest pain, or shortness of breath, seek immediate medical attention. These could be signs of a serious heart condition that requires prompt diagnosis and treatment. You might be surprised to learn that potassium deficiency can also impact your bones and nerves. Potassium plays a crucial role in maintaining bone density and preventing bone loss. It helps regulate the balance of acids and bases in your body, which is essential for healthy bone metabolism. When your potassium levels are low, your body becomes more acidic, leading to calcium loss from your bones. This can weaken your bones, making them more susceptible to fractures. Over time, potassium deficiency can contribute to osteoporosis, a condition that makes your bones weak and brittle. But it's not just about bone health. Potassium deficiency can also affect your nerves. Potassium is essential for transmitting nerve impulses, the electrical signals that allow your nerves to communicate with your brain and muscles. When potassium levels are low, these signals get disrupted, leading to numbness, tingling, and even muscle weakness. Believe it or not, potassium deficiency can even affect your breathing. Potassium plays a vital role in maintaining the function of your respiratory muscles, the muscles that control your breathing. These muscles, including your diaphragm and intercostal muscles, contract and relax rhythmically, allowing you to inhale and exhale air. When your potassium levels are low, these muscles become weak and inefficient, making it harder to breathe. You might experience shortness of breath, especially during physical activity, or feel like you can't take a deep breath. In severe cases, potassium deficiency can lead to respiratory failure, a life-threatening condition. Imagine your lungs as bellows, with your respiratory muscles acting as the handles. Breathing difficulties can be alarming, especially if you're not used to them. If you're experiencing shortness of breath, wheezing, or chest tightness, seek medical attention promptly. It's crucial to rule out any serious underlying conditions and address the issue promptly. Potassium plays a crucial role in regulating blood pressure. It helps counteract the effects of sodium, a mineral that can raise blood pressure. Potassium helps your body get rid of excess sodium through urine, relaxing blood vessel walls and lowering blood pressure. When your potassium levels are low, your body retains more sodium, leading to increased blood pressure. High blood pressure, also known as hypertension, is a silent killer. It often has no symptoms but can damage your arteries, heart, and other organs over time. Imagine your blood vessels as pipes, and blood pressure as the water pressure flowing through them. If you're experiencing high blood pressure, lifestyle modifications like a healthy diet, regular exercise, and stress management can help lower it. Let's talk about another symptom of potassium deficiency, polyuria or frequent urination. Potassium plays a role in regulating fluid balance in your body. When your potassium levels are low, your kidneys work less efficiently, leading to increased urine production. You might find yourself needing to use the bathroom more often, even at night. This frequent urination can be disruptive, affecting your sleep and daily routine. In some cases, it can also lead to dehydration if you're not replenishing fluids adequately. If you're experiencing frequent urination, especially in conjunction with other symptoms like fatigue or muscle cramps, consider the possibility of potassium deficiency. Addressing the underlying deficiency can help restore normal kidney function and reduce urine output. So there you have it, folks. We've explored the ins and outs of potassium deficiency, from its subtle signs to its serious consequences. If you suspect you might be suffering from potassium deficiency, don't hesitate to reach out to your healthcare provider. They can assess your symptoms, order appropriate tests, and recommend personalized solutions to address the issue. Remember, early detection and intervention are key. And as always, thanks for tuning in. Don't forget to like, subscribe, and share this video for more health insights.